In this video, I am telling in constipation history what are the important points we need to discuss. First, remember the mother may be complain that her children has diarrhea because the child has diarrhea but it is actually constipation with overflow and swelling and means interpreted as diarrhea. Okay. So how can we take the constipation history? The chief complaints is like onset, course and durations, what make it better and what make it worse. So when it started, how long suffering, frequency of the poo, hard poo, describe me the poo. From the Bristol chart we take the help. Then straining during poo, blood in the poo, skin tags from back passages, straining of the underwear, swelling, potty trained or not, holding behavior like crossing his legs back, arching and tiptoeing. So using Bristol chart, we know that there are 7 steps of the Bristol. Type 1, that is like rabbit dropping. Type 2, bunch of grapes. Type 3, it is corn on the cap. Type 4 is sausage type. Type 5 is chicken nuggets. Type 6 is porridge. And type 7 is gravy. So we can ask like that how it looks like. It's rabbit, bunch of grapes, like sausage, chicken nuggets, like that. And this is the chief complaints analysis. And other some important point during constipation we take keep in our mind, like dysmorphic features. Sometimes what happen, like Down syndrome with hypotonia, that is constipation is a problems. CNS, headache and lower limb any weakness. So lower limb weakness, that is also needed. Frequency and for the UTI associated with constipation. So P history we ask, like frequency of pee, painful peeing, fever present or not. Then MSK, normally there is a carving or deviation of the back, tuft of hair or skin dimple in the middle of his back, spina bifida. So spina bifida we search. Thyroid, hot intolerance, weight gain, delayed school performance. So thyroid very common in MRCPCH clinical exam. The history, hot intolerance, weight gain, delayed school performance. Keep in mind. And also in perinatal history, like when passed the poo for first time, we keep. Nutrition history is very important. We asked about the nutrition type, amount, change in diet, fibers, drinks water sufficiently, junk food. So drink water sufficiently, junk food as most common functional constipation coming. So nutrition history important. Social history is very important, like did he start his nursery or school, move to a new place, new school, enjoying the new school, swelling at school and bullying issue. So these are the point we keep in our mind when you take the constipation history. I am telling the differential diagnosis of constipations. So defecations infrequent, less than 3 times in a week, or hard stool or straining more than or equal 1 month. Normal constipation history come, functional constipation come. Normally in exam, that is 90 to 95% of constipation beyond the neonatal period. So what are the functional constipation? That is decreased fiber or fluid, decreased activity or exercise, habitual ignoring of the urge, then changing the diet or daily routine, stress, anxiety, depressions. These are we keep in our mind, functional constipation. Now about organic cause. Organic are suspected in presence of red flags like Hirschsprung's disease. So when he passed the fast poo, very important. Neurogenic, like lower limb neurological examination required, CP, hypotonia, cerebral palsy, spina bifida, meningomyelocele, spinal cord trauma, T-third cord, neurofibromatosis. So any unusual features, any dysmorphic features, these are very important. Any chronic conditions, CP, one of the cause of constipations. Endocrine, already I tell, hypothyroidism, that is weight gain recently, school performance is not good going. These are any hot or cold intolerance. So thyroid problem, hypothyroidism, hyperparathyroidism, hypercalcemia, hypokalemia, diabetes mellitus, diabetes insipidus. Malabsorption, cystic fibrosis. Cystic fibrosis associated with loose motions, that is meconium milas, distal intestinal obstruction syndrome. So cystic fibrosis, there is repeated chest infection we find. Celiac disease, we know that the loose stools present with buttock wasting, there is abdomen distended, and mainly difficult to flush the stool and foul spinning. And cow's milk protein intolerance, allergy, cow's milk protein intolerance, also cow's milk taking, the history will give us, and some allergy history give. Drug induced and toxins are opioids, iron, narcotics, vincristine, crayon, for exocrine pancreatic insufficiency, vitamin D intoxication. So iron taking or not, vitamin D taking, crayon for cystic fibrosis or not. Lead, like old home they are living or not, because old pipe sometimes. Anal anatomical malformations or disease. Anorectal examination required. So in examination we'll examination the rectum, because anal stenosis, anal fissure. UTI I already tell I. So P history very important, structural like post-operative and post-NEC. Others are SLE and scleroderma. Anorexia nervosa, NAI, and child abuse. Child abuse is very important. We can ask one question like, do you think anything threaten his safety in home, like that? So this is all about constipation. How can we chief complaints analysis and the DD. Thank you.